Following a road accident on his way to work, 35-year-old Sanjay from Kathmandu suffered a fractured leg necessitating surgery. The procedure initially seemed successful and he was discharged from the hospital. However, during subsequent follow-up visits, it became apparent that his wound was not healing properly. His doctor later discovered that Sanjay's knee had been infected with an antibiotic-resistant bacterium post the initial surgery. Sanjay would go on to develop numerous recurring infections, forced to spend months in hospital, unable to work, causing immense stress for both him and his family. Eventually, he underwent a second surgery to address the irreparable damage to his bones where infection had spread. Cases like Sanjay's are increasingly common today due to the rise of antimicrobial resistance or AMR. This top global health threat of our times is making infections harder to treat, leading to prolonged hospital stays, higher medical costs, increased mortality, morbidity, and disability. Each year, around 700,000 people worldwide die due to drug-resistant infections. If no action is taken today, drug-resistant infections are estimated to kill 10 million people a year by 2050. To reduce the impact and spread of AMR, we can all play a role. As individuals, we can modify our behavior to adopt appropriate usage of antimicrobials. This includes taking antimicrobials only when prescribed by a certified health professional, never sharing or using leftover antibiotics, preventing infections by regularly washing hands, preparing food hygienically, avoiding close contact with sick people, practicing safer sex, and keeping vaccinations up to date. Similarly, policymakers can work to ensure a robust national action plan to tackle AMR, strengthen policies, programs, and implementation of infection prevention and control measures, and regulate, among other steps. Health workers must also prescribe and dispense antibiotics only when they are needed and counsel patients on the correct usage of antibiotics. On World Antimicrobial Resistance Awareness Week, let's commit to conserving antimicrobials so that our future generation can experience the power of these life-saving medicines. And remember to always handle antimicrobials with care. Together, we can prevent AMR.